An exciting expedition through the forests of West Africa is about to take a deadly turn. A startled bat comes out of nowhere and sinks its teeth into your hand, injecting the Ebola virus into your bloodstream. This hemorrhagic fever virus is notorious for intense inflammation and tissue damage throughout the body. Ebola disrupts the body's clotting mechanism, potentially resulting in internal and external bleeding. No wonder it has an average fatality rate of 50%. Brace yourself because things are gonna get ugly, like bleeding from your eyes ugly. When will the first symptoms appear? What can you do to fight it? And how long do you have until the virus kills you? The answers to these questions and more as we put you in the shoes of an Ebola victim. But for now, let's go to the moment of exposure. The Ebola virus enters your body through broken skin or mucous membranes in your mouth, nose, or eyes. Once it's inside you, the virus wastes no time in launching its assault. It infiltrates your immune cells, particularly your macrophages, the guardians tasked with protecting your body against invaders. The sneaky virus hijacks the cells, forcing them to produce countless copies of itself. This marks the beginning of a relentless attack against your body's defenses. The worst part? You won't feel a thing. You are a ticking viral time bomb. But the invasion won't stay silent for long. You might feel something is wrong before the end of a week. As the incubation period progresses, the virus gradually spreads throughout your body, infiltrating your tissues and organs. Common early symptoms of Ebola include fever, usually accompanied by headache, muscle pain, and fatigue. Initially, these symptoms might be mild and non-specific, like a common cold. At this point, you'll be taking some over-the-counter medications to control your fever and pain. But by day 7, brace yourself for a hellish experience. This virus is ready to show its true colors. You'll know something is definitely wrong when you start feeling sharp abdominal pains. Your gastrointestinal tract is under siege, causing constant diarrhea and vomiting, which leads to severe dehydration. Yeah, I know it sounds bad already, but we're just getting started. Ebola causes significant damage to the liver, compromising its function and leading to a condition known as viral hepatitis. This will likely lead to jaundice. That's the yellowing of the skin and eyes due to the buildup of bilirubin in your bloodstream. By now, you're probably aware that this is not a typical flu and you should be getting medical attention ASAP. Also at this point, your body's fluids are spreading the virus, so you should isolate and have a private bathroom until you get some tests done. If you're certain that you have Ebola, it's important now to retrace your steps over the last few days and determine the source of the virus. Identifying the cause of an outbreak early on can save your life and those around you. Okay, this virus can't fool your immune system forever. For the next 1 to 2 weeks, your body will mount its counterattack. Immune cells called B lymphocytes kick into gear and make antibodies which latch onto the virus and stop it from infecting more of your cells. Then, another branch of the immune system activates, producing T cells that go around hunting down and destroying the infected cells. Sounds like a good thing, right? Well, with Ebola, it's never that simple. In some cases, the immune response to the infection gets out of control, leading to a phenomenon known as a cytokine storm. This happens when you produce too many chemicals called cytokines, causing inflammation and damage to the body. Cytokines are small proteins that help control the activity and growth of your immune cells and blood cells. If your body produces too many of them, the results can be deadly. You can expect high fever, trouble breathing, vomiting, and diarrhea. If your sickness gets worse, doctors may use drugs to reduce inflammation and lower your fever. And you'll need to get IV fluids to prevent extreme dehydration. But the complications get a little more serious when you reach the 14-day mark. The infection may start to spread rapidly through your bloodstream, causing septic shock. This dangerous drop in blood pressure can lead to organ failure and, in some situations, death. Ebola can mess with your kidneys too, making it harder for them to clean your blood and to keep the right balance of salts and minerals. One particularly frightening complication is disseminated intravascular coagulation, or DIC, which is a fancy way of saying that the body's blood clotting system has gone haywire. This is scary. DIC may cause bleeding from the gums and eyes to the gastrointestinal tract and even the brain. And it's usually the most life-threatening aspect of the disease. This means all hands on deck for the medical team. They'll continue the fluids to keep you hydrated, assisted ventilation to keep enough oxygen in your body, and even dialysis to help clear waste from your blood. They might also have to use vasopressor drugs to help raise blood pressure and give you medications to help your blood clot. At this stage, you'll have to be isolated, and the doctors treating you will have to wear masks and biohazard suits to avoid contagion. The third week marks a crucial point where you can begin to recover or get closer to dying. Survival rates during this phase depend on different things like how old the person is, how healthy they were before getting sick, and whether or not they have access to good medical care. For some, the body might be able to fight off the virus and start healing, but for others, the illness might get more severe, making it harder to recover. There is no specific treatment for Ebola. What doctors do is treat the symptoms and hope that the body is able to fight off the virus. According to the CDC, there's no universal Ebola vaccine yet. However, the first FDA-approved Ebola vaccine, called Ervebo, has worked wonders in stopping the spread of the Zaire strain. It's mainly given to high-risk individuals like family members of patients or healthcare workers. After 21 days, severe complications of Ebola like hemorrhagic fever and systemic organ failure can lead to shock and ultimately kill you. When handling deceased individuals infected with Ebola, proper personal protective equipment is essential. The virus remains contagious even after death, thanks to its resilience to moderate temperature shifts. Now, if you were lucky enough to detect the illness early and get quick medical attention, you'd likely be part of the 50% that survives Ebola. But don't go celebrating just yet. You might continue to experience body aches and weakness for weeks or even months after recovering from Ebola. And for the men watching, don't think you're safe to, well, get it on at this point. You're advised to wait 3 months before having sexual relations, since the virus will still be present in other body fluids. For women, it's recommended to refrain from breastfeeding until after you've consulted with a healthcare professional. The good news is that you might have 10 years of immunity against the virus now, but scientists have yet to establish if this applies to all subtypes of Ebola, so don't press your luck. Ebola's 50% fatality rate is scary, but that's nothing compared to rabies. Once you develop the symptoms, rabies has a 99.9% chance of killing you. Learn how to stop it in time here on How to Survive.